we received a total of 13 patients.
Dr. John Alexander had just gotten home from work on October 25th, 2023, when he got the call.
Incident command was being activated and that there was a mass shooting. And so I quickly turned around and got back in my car and started coming back.
He and well over 100 team members, including doctors, nurses, technicians, and more.
And yeah, our surgical teams, we had at one point 4 operating rooms running at one time with multiple surgeons in each of those rooms. It's just not something that we usually do. But we do train for those experiences.
The training turned into a real-life scenario, and the recovery process was just beginning for their patients.
Our last patient, who was a shooting victim, left a few days before Christmas. Dozens of team members, nurses, technicians, support staff, physicians would line the hallway, and we would say goodbye to and congratulate those individuals for their bravery.
In June, the trauma response team at CMMC was recognized for their life-saving work with the Maine Hospital Association's Caregiver of the Year award.
And when we heard about that we were receiving the award, it's just an incredible honor to be recognized by your colleagues. Prior to that, we had shared with the Maine Hospital Association and many of our member hospitals some of the lessons that we had learned.
Dr. Alexander says those lessons include a robust communication process.
Most of the people who were coming in weren't called in. They heard about the event and they were coming in on their own to help out, which is incredible. Once that happens, you have to then assign roles to these individuals or have an area, what we call a staging area, for people to go to say, okay, I'm glad you're here, thank you. I don't have a role for you just yet.
And that communication applies to patients as well.
That became a challenge to manage and understand who was coming in from one of the scenes, who was coming in from something else, who were family members just looking for loved ones.
They also learned the importance of having a plan to take care of their 3,200 employees and other patients at the hospital, especially counseling services.
We pulled it together very quickly, but that was something that we've now put more into a written plan, that now we know what we can do and how we can do it next time.
As we mark 1 year since the tragedy, Dr. Alexander says each person at CMMC is acknowledging the day in their own way, and he remains grateful for the community coming together on their darkest day and the days that followed.
For at least 3 or 4 weeks, we kept receiving donations of food and cards and other items of thoughts and memories from the community, just in support of our team. We felt just a special closeness to our community. It made us stronger. Our hospital is here to provide health care, but our community provides care beyond that to so many members, that's something that I think is important for us to remember.